Okay. Good afternoon, and thank you for coming and welcome. Our presentation of today will be focused on ParActin and its active ingredient, Andrographis paniculata, and especially the research we have been doing with our colleague, Professor Burgos, from Universidad Austral de Chile, over the last, I would say, almost 30 years. And as you can see there is a lymphocyte and a neutrophil that speaks about the field of action of ParActin, which is mainly immunity and inflammation. Next one. To keep it very simple, the main botanical of ParActin, which is a medicinal plant known as Andrographis paniculata, is there. You can see it. It's a bush about 3 meters in height with a nice white flower. And next one, where does it grow? In the southeast countries, mainly you can find it in China, the northern Malaysian peninsula, in Thailand, Indonesia, and Java. And nowadays, you can wild harvest, or you can also grow it, and in different countries. Next one. The question is, what does it contain? It contains a crystalline substance known as andrographolite, in relationship to its plant, and it's a bitter, colorless, neutral crystalline substance, and it corresponds to a diterpenic labdane, right? And this is very much well known, and even there was a publication in the journal Nature that appeared in 1909. The next one, if we look at the ethnobotanical use, Andrographis paniculata has a long history of use in the traditional medicine of China, and also in the Ayurvedic system of medicine, right? So it goes back 2,000–3,000 years back in history. And in the Western country, it is already appearing in the textbook of pharmacology and therapeutics in the year 1901, Pharmacographica Indica, London, 1890. The other interesting point is that it is considered as a food ingredient and a flavoring agent, substance, by the Ministry of Agriculture, Fishery and Food of England, by the Council of Europe. And perhaps this is an interesting point also. Andrographis paniculata has a long tradition of use as a herbal remedy for gastric disorders, anti-inflammatory, and treatment of common cold. And in 1997, the World Health Organization issued a monograph where you can find 4 traditional medicinal plants, right? And this is available widely. Next one. What does ParActin contains? It is a standardized powder, dried, containing a 50% of total andrographolite. Here you can see the HPLC, where you have the first peak, which is andrographolite. You have neo-andrographolite, which is a glucose attached, and dehydroandrographolite. Of course, it has many other substances, that probably helps to the biological effect of the plant. Next one. In 1903, there was a publication by an Indian group of Puri et al. That described the immunostimulant properties of this andrographolite, which triggered, so to say, the research in common cold. And at that time, this was about 40 years ago, I was in Sweden, and they had a product for common cold known as Kanyang. And we were the first group in the Western world to start with this publication in phytotherapy research with a double-blind study with this monograph called Kanyang, where we described the decrease of symptoms in the involvement of common cold. From that on, it followed 2 other clinical studies, and which was for the prevention of common cold in a group of students, after 3 months of administration, where you could see that the episodes of common cold were diminished. And then at the late in the 90s, we published another study in phytomedicine using a visual analog scale to assess the effectiveness of the same product. And the effects were similar. So in this sense, the Swedish Herbal Institute, pioneered, the use in the Nordic countries for Andrographis paniculata. So that's how the story really began for this medicinal plant in the Western world. Next one. And of course, many publications followed, reviews, like this review that appeared in 2004, where they investigate the effect of different composition of Andrographis paniculata for the treatment of upper respiratory tract infections, and also this other group, that described, different studies. Next one. Then you had the meta-analysis, right? All focused on the effect of symptoms relief of acute respiratory tract infections in adults and also in children. And the numbers of patient studies were huge, You have 7,000 to 10,000 patients. And there was another group from Germany and from different countries. Next one. And at the moment, we have an ongoing study that was completed for studying the effect of our ingredient, this time ParActin, for the treatment of common cold, which is in process of analysis. And in this case, we also studied a fruit, which is Aristotelia chilensis, which is a maki fruit, because we know also like elderberry, has certain similarities that could, have a potentiating effect with Andrographis. So you can follow up this in the clinical trials got identified. There you have the number. The next one. So the first chapter, so to say, of Andrographis paniculata was just one track. Investigation from, I would say, the 80s to the 90s, which was in common cold and acute infections of the upper respiratory tract infection. Next one. So to describe this, the symptoms of the common cold appear to result from the effect of inflammatory mediators released in response to different viral infections of the respiratory tract. You have coronavirus, you have rhinovirus, syncytial influenza, and so on. And the acute respiratory tract infections include rhinitis, pharyngitis, tonsillitis, laryngitis. And even now, you see there are about 3 publications, just I mentioned this, for COVID that appeared for the product. And the next one, Rafael Burgos will explain the mechanism of action which we have investigated thoroughly, during the last years.
Okay. As mentioned, Juan, respiratory diseases are characterized by inflammatory symptoms. Thus, the reduction of acute inflammatory response is a potent effect of andrographolide to recover one of the characteristic response of inflammation, that is the loss of function tissue. NF-kappa B is a master controller of inflammation. Following a pro-inflammatory stimulus, in this case is PIF, this stimulus activates the receptor and the protein in the downstream of the signal that is called I-kappa kinase. Occurs after that a phosphorylation of I-kappa-B. This protein is degraded and releases the nuclear factor, which travels to the nucleus. This induces the expression of several pro-inflammatory genes, including COX-2. Two articles about the role of andrographolide in the NF-kappa-B pathway were published simultaneously, one of them by our group. We showed that andrographolide interferes with NF-kappa-B binding to DNA and neutrophils. That is a leukocyte increase in acute inflammatory response. In this slide, we use PAF, which produce an increase on NF-kappa-B binding in the neutrophil nucleus. In this experiment, andrographolide significantly reduced DNA binding of this nuclear factor. Andrographolide induced an interference of NF-kappa-B binding in the neutrophil nucleus, reducing both PIF and F-LIMP, inducing COX expression. This suggests that the anti-inflammatory effect of andrographolide is independent of the stimulus used. Other authors also demonstrate that andrographolide inhibits NF-kappa-B binding to DNA. In particular, andrographolide covalently modifies cysteine 62, or the P50 subunit of NF-kappa-B. In this article, it was shown that andrographolide reduced NF-kappa-B binding activation induced by TNF-alpha and interleukin-1 beta, and also LPS in endothelial cells, whereas an andrographolide analog does not produce such potent effects. In experimental models, mouse models, andrographolide prevents septic shock by reducing the mortality induced by LPS administration, including the lungs of this animal were analyzed for the binding of NF-kappa-B, and it showed in the model an increase of NF-kappa-B binding, and the effect of andrographolide is the reduction of this effect. Another model was shown to prevent the presence of eosinophils in a rodent model of allergic lung inflammation. This is a model similar to asthma, decreasing the eosinophil counts in the lungs. The background allows us to propose as a mechanism of action that andrographolide affects NF-kappa-B pathway independently of the stimulus uses, and thus exert a potent anti-inflammatory effect. However, andrographolide also affects T cells, which play an important role in chronic inflammatory response and autoimmune diseases. We showed that andrographolide reduced cytokine T cells expression. In this slide, we can see the effect of andrographolide reducing the interferon gamma production in T cells induced by concavalin A. In addition to interfere the NF-kappa B binding, we demonstrate that it reduces MAC kinase pathways and nuclear factor-activated T cells pathway. Thus, andrographite is a potent anti-inflammatory with several mechanisms of action. Today is a more complex situation. In this figure, we summarize the several pathways controlled by andrographite. These are a lot upstream effect, upstream to NF-kappa B pathway effect, and also controlling another transcription factor. This situation adds a new avenue. There is a close relationship between inflammation and metabolic reprogramming in leukocyte. In fact, andrographite interfere with several pathways to reduce the metabolic effect during inflammation. For example, glycolytic effect. Andrographite directly or through NF-kappa B can control the expression of hypoxia-inducible factor 1. This factor regulates glycolytic metabolism and control the expression of pro-inflammatory molecules. Juan, please.
So, as Rafael was explaining, as time passes, new mechanism of actions are added to the pure compound. If we look at the publications of Andrographis paniculata over the years from 1980 to 2022, the first publication that appeared on Common Cold was in 1995, which was the phytotherapy research. And then in 2004 was the groups from China and ourselves that published the mechanism of action, one of the first one, which triggered, the increase, in the publications of Andrographis paniculata, right? The next one. So, from the conclusions we can draw so far is that the effects of Andrographis paniculata are linked to its ability to control inflammation, right? Through the inhibition of different transcription factors, including COX-2, interleukins, and so on. And being this the case, obviously this opens the possibility that we can modulate the immune response to several inflammatory processes and therefore diseases. So the picture changes, and you remember we had one track line, only common cold, and this, through the mechanism of action, opened the possibility to use andrographite in other chronic diseases, not only acute diseases, but for, in example, rheumatoid arthritis, multiple sclerosis, which is an autoimmune disease, lupus erythematosus, and Alzheimer, where we have done a great deal of research with some colleagues from the university in Chile. So we have a complete different picture now. So the next one, I will show you some of the clinical studies we did on rheumatoid arthritis. This was published in Clinical Rheumatology in 2009 at the hospital in Chile, where we studied the effect of ParActin for the relief of rheumatoid arthritis symptoms. That was a prospective randomized placebo-controlled trial. Next one. And here you can see the flow chart. These were patients that were confirmed active rheumatoid arthritis by X-ray of the hands and feet that had 4 more inflamed joints and with a PCR higher than 0.6. And we had 30 groups in the placebo and 30 with the ParActin group. And here we have the picture for the point of the presentation that the group given ParActin had a much better effect on the release of tender joint as compared to the placebo. Also, a decrease in the total grade of tender joint, doing better. And also the rheumatoid factor was significantly reduced as compared to the placebo, right? That was our first, so to say, clinical study published in this autoimmune disease. Next one. And simultaneously, we had done many individual cases of the use in the long-term case of ParActin. And in 2013, we published a review on the potential use of andrographolide for long-term treatments of rheumatoid arthritis. Next one. And in this case, you can see that the duration of the treatment in this case went from almost 3 years up to 5 years in different types of diagnosis like rheumatoid arthritis, rheumatoid spondylitis, vasculitis, psoriatic arthritis, rheumatoid arthritis serositis, and so on, and with different ages. And the results show, next one, that there was a decrease in the erythrocyte sedimentation rates and the C-reactive protein. Next one. And the rheumatoid factor and stiffness. Next one. And in the fatigue and also in pain. And this is interesting because this is a symptom that affects many patients suffering from autoimmune disease. Next one. And then we looked into osteoarthritis. And some of the osteoarthritis facts is that one of the most frequent forms of the disease is knee osteoarthritis, which goes up to 61%. And the problem is that over the years, the prevalence of the disease will increase in men and women. And on the other hand, it is very closely related to the body mass index. As the body mass index increases, you have a higher risk of knee osteoarthritis, right? And in the coming years, so we know this for sure, that there will be a high prevalence in the population, right? And so we decided, in next one, to go and to study this. And if you look at the brief history of osteoarthritis from the 1A00 to the present, you can see all the history, but unfortunately, no drug therapy exists today to stop the progression of the disease. Most of the products, either it's chemical or is it botanical, they have been used for shorter period of time, like 3-4 months, not more, but they do not hold the progression of the disease. So next one, there is a lot of publications, preclinical, on the effect of andrographolide on inducible nitric oxide synthase in human osteoarthritic chondrocyte. And you can see here the production of metalloproteinase, like number 13 and number 1, which is closely related to osteoarthritis. And you can see when you increase the dose of andrographolide, you get a dose-dependent decrease of this metalloproteinase. And in 2019, we published this double-blind randomized placebo-controlled study to study the efficacy of ParActin in pain reduction of knee osteoarthritis. And this was published in Phytotherapy Research. We were on the front page of Phytotherapy Research. Next one. And in this case, we use two groups of doses, one with 600 milligrams per day, and the other group with 300 milligrams per day, 37 and this 35, and a placebo group with 36. And the analyzed group are here. And the results show the following. Next one. If you look at the WOMAC pain scale, you can see that after almost 90 days, there is in the two groups, either treated with 300 or 600 milligrams, there was a strong, significant decrease of the pain, of the stiffness score, the total WOMAC score, and also the physical function score. All right? And the next one, at the present, if we compare the attributes of ParActin, like with AINES, the classical anti-inflammatory drugs, paracetamol, conditrine, and opioids, all of them, they have a reduction in pain, right? However, ParActin has few adverse reactions. The AINES have problems. We all know that they can produce, in example, heart attacks, bleeding, ulcers. In the case of paracetamol, can produce hepatic damage, kidney disease. And while conditrine has mild adverse reaction, as the same as ParActin. And opioids, of course, there is the problem of addiction in long treatments and the risk of severe adverse reactions, like, for example, respiratory arrest. And then if you look at AINES, paracetamol, any other product like conditrine sulfate, glucosamine, or opioids, they have no effect in controlling the joint destruction and the progression of disease. Independently of that, the progression of the disease goes on, right? However, ParActin, by inhibiting the joint catabolic processes, may prevent the joint erosion and may affect the progression of the disease. And this is something we are investigating now in a clinical study, next one, where we are evaluating on a long-term administration of ParActin of almost a year, evaluating the change in joint space, narrowing in the tibiofemoral joint measured by MRI and compared to a placebo. That's the primary objective of our study. Then the secondary outcomes, there is change in cartilage thickness, then there is change in cartilage turnover as assessed by change in serum levels of cartilage matrix protein, the ones we mentioned, joint pain using WOMAC, mobility of the joint, also using WOMAC, and also the quality of life using the SF-36 score. Right, so this is ongoing, and we hope to finish it by the end of the year. So this is what we have to say about osteoarthritis, the next one. We also explored multiple sclerosis I would say, in great depth. And just to give you a briefing, multiple sclerosis is another autoimmune disease, and because of the mechanism of action of andrographolides, we thought this could be of help. And the disease is characterized by inflammation of the central nervous system and neurodegeneration within the neutral substance. And in the US, you have the figures between 250 and 350,000 patients. In Europe, 400,000 patients, and worldwide about 2 to 3 million, right? Next one. Well, multiple sclerosis has two forms of the disease. One is called relapsing remitting because, every certain periods of time you have a flare up, which means the whole system is inflamed. you got strong inflammation and disability associated, which accounts for the 85% of all patients. And then of this 85 patients, half of them go into secondary progressive form of the disease. Then, from the very beginning, you have another 50% that they have the primary progressive form of the disease. They have no relapses, but there is a steady progression of the disease until the person basically, is completely disabled. The interesting factor is that 80% of most of the patients do suffer from fatigue. And there is a very disabling symptom. And nowadays, there is nothing they can give, or offer. So we said, because of the data we had from early clinical studies in rheumatoid arthritis, we said, perhaps this can work. Next one. So, and the treatment is based, as I said, there are disease-modifying drugs that reduce the incidence of the relapses, one thing. But unfortunately, 1/3 of this do not respond to this first line of treatment. And then, no treatment for the progressive form. Nowadays, there are a few ocrelizumab, like drugs that do, but the effect is still still not evaluated, and also extremely expensive drugs. And practically not a single treatment for fatigue. Next one. So we decide to make a clinical study based on the data we had in the rat model of experimental autoimmune encephalitis in the mouse, where we saw very clearly that the clinical scores of the disease were much lesser in the group treated with andrografolide as the one treated with the placebo. So we decided to do a clinical study with the specialists in multiple sclerosis at the university, and we give for 12 months ParActin to patients that had relapsing remitting multiple sclerosis, and measure lesions, disability, and also fatigue. And we could see clearly that when we compared after 12 months the data of fatigue versus the day 0, there is a significant decrease in the fatigue in these patients. And also in this patient, you have lesser demyelinating lesions in the brain as compared to the placebo. Next one. So we also, the group of scientists and specialists in neurology decided to test the effect of the pure compound now that we call neuroactin in the progressive form of the disease. So we did an exploratory double-blind parallel group randomized placebo control in the non-active progressive multiple sclerosis. These are patients normally that there is nothing they can give. They have a scale of disability of almost 6 of the McDonald scale, which means that practically some of them, are on the wheelchair. And what we measure here is brain atrophy. So after 2 years of administration, we study whether the brain was shrinked or not, and this was measured by MRI. And you can see that the relative reduction in the group in green that was giving andrografolide was 36% lesser than the one with the placebo. And the analyzed brain parenchymal fraction was 75% less reduction. So, and this was significant. And on the other hand, here we have the relative risk reduction of disability progression, you can see that the line here in green was much better. The disability started in the placebo group much at the earlier stage as in relationship to the group giving andrographolide, right? So the effect is quite clear. And so about 2 years ago, the magazine Multiple Sclerosis, made a publication indicating that andrographolide could be a good candidate, to be explored for the pharma for the treatment of progressive multiple sclerosis. So the next one. So to make a summary of the pipeline we are doing 20 and 23, there is this ongoing study on osteoarthritis on the knee, which is in phase 2, and that is going to be completed by the end of this year. On the immune, we have the study that was completed in common cold and upper respiratory tract infections, also in combination with some other products. And also we are doing studies in muscular dystrophy, particular muscular dystrophy of Duchenne. This is a disease that affects children that by the age of 20, they are completely disabled, and they are on a wheelchair. And so it's a very sad story, and we had the opportunity to investigate this together with a group of scientists and medical doctors at the university in Chile. And so we have data now that strongly suggests, that the children can have better mobility and we can block the progression of the disease. So basically, this is what I have. Go ahead. So ParActin, we could say that from the health claim, functional, supports healthy immune response, healthy inflammatory response, joint function, joint and eases joint flare-ups, improves flexibility and mobility, maintains bone mass and strength, supports muscle health, supports healthy cartilage. And here, are many of the qualities. It's wild-crafted, non-irradiated, vegan, kosher, and so on. And also is available in organic and conventional form. Next one. Well, I would like to thank Dr. Cárcamo, the MD, and Dr. Untitled Chapter, which are both of them are neurologists. They studied at Harvard University, both of them. Professor Brandam, that is an expert worldwide in the field of muscular dystrophy. And Rafael, which works as the professor of pharmacology, dean of the faculty in Chile, and also thanks to the group of HPI. So thank you very much for the attention.